Newly pregnant? Wondering where to go for prenatal care? Today we're going to cover what to expect from a midwife versus an OBGYN, as well cover the biggest mistake I most often see women make at their first prenatal appointment. If you're new, my name's Jess. I'm a certified nurse midwife and infertility mom, and I'm currently 11 weeks pregnant after a frozen embryo transfer. And before you think I'm going to go recommending midwifery care to everybody, I absolutely am not. Midwifery care is certainly not for everyone. Some women are going to risk out of it, and some women just don't have the personality for it. This is not a video pitting midwives against OBGYNs. We each offer different services, both of which are valuable and necessary. So my goal is for you to walk away from this video and be able to understand what you can expect from different types of prenatal care providers. I'm going to start with talking about certified nurse midwives, since that's what I am. A certified nurse midwife, or CNM, is first a registered nurse who then goes back and gets a graduate degree specializing in women's health, pregnancy, and low-risk childbirth. This graduate degree can either be a master's degree or a DNP, which is what I have, which stands for Doctor of Nursing Practice. Depending on the state that they practice in, they may or may not require physician oversight. So for example, I practice in Washington State and I don't require any physician oversight. I can write prescriptions, attend births, and see patients completely as an independent provider. It's typically states in the South, like Texas and Louisiana, where midwives are required to have more physician oversight and they're more limited in what they can do. I do collaborate with the physicians that I work with. I love that they're readily available for me to consult if I need. And then I also always have someone backing me up. So if I'm on call to attend a birth, there's always a provider on call who is qualified to perform C-sections with me if needed. Most certified nurse midwives practice in a hospital setting, meaning that you can get an epidural for pain management if you want. And we've also got access to all the hospital resources if needed. The most important thing that a certified nurse midwife can offer you in a hospital setting is continuous labor support. So someone to help you breathe through your contractions and help coach you through pushing. We also usually have longer appointment times than OBGYNs. So for example, I have 30 minutes for all of my patient visits, but this is going to vary from practice to practice. You can continue to see your certified nurse midwife after pregnancy for pap smears, breast exams, and birth control as well. There are different types of midwives. So there are also licensed midwives and certified professional midwives. And these are midwives who got a master's degree in midwifery after having a bachelor's degree in any field. So they are not required to be nurses first. In lieu of a master's degree, they could also go the apprenticeship route and attend a whole bunch of births with another midwife while also taking classes independently before taking the state exam. Licensed midwives and certified professional midwives are not legal in every state. They are only eligible for licensure in 33 states, and again, it's typically the southern states that don't allow them to practice. These midwives typically don't have hospital privileges, so they usually practice doing home births or at freestanding birth centers. They can't write prescriptions the way certified nurse midwives can, but they do have access to some medications, and those are usually the medications to control a postpartum hemorrhage or too much bleeding after a birth. Licensed midwives also typically have longer appointment times, so you can really get to know them during your visits, but they're not going to provide well-woman care or birth control after pregnancy. They're usually just going to care for you during pregnancy, birth, and the initial postpartum period. They also provide continuous labor support, and they'll do things like clean up your house and make sure you're fed before they leave. If I had truly understood the difference between licensed midwives and certified nurse midwives before I went to school, I honestly think I would have become a licensed midwife instead. As a certified nurse midwife, I'm really practicing from the Western model of medicine, whereas licensed midwives are typically more holistic. Licensed midwives really are the best at honoring natural, uninterrupted physiologic birth, whereas because I practice in a hospital and so many of my patients choose to get epidurals, I'm more likely to recommend Pitocin or other interventions like that. And I'm not saying that epidurals or Pitocin are terrible. They certainly have their place. That's just not what I had envisioned when I became a midwife. That being said, I do think we need more crunchy midwives like me practicing in the hospital to kind of bridge the gap between those two types of care. So hopefully I'm doing some good out there. Moving on to physicians. An OBGYN is either an MD or a DO that went to medical school and then completed a 4-year residency in obstetrics and gynecology. So in addition to providing prenatal care and attending births, they can also provide vacuum-assisted vaginal deliveries, cesarean deliveries, and a myriad of gynecological surgeries. These are the providers you want to choose if you know your pregnancy is high risk. So for example, you definitely want to see an OBGYN if you have a really rare bleeding disorder, if you have chronic high blood pressure outside of pregnancy, or if you're diabetic prior to pregnancy. And these are just a few examples. There's a lot of reasons why a pregnancy could be high risk. It's also okay to choose an OBGYN if that's just what you're comfortable with. It is good to note that most OBGYNs are going to have shorter appointment times. So a lot of times like in the 15 to 20 minute range, though I have worked in an office where the OBGYNs only had 10 minutes with their pregnant patients. They're not going to provide the continuous support that a midwife would. So if you have an OBGYN for your birth, You'll mostly be seeing the nurses during your labor. The OBGYN will check on you periodically, and then they will be present at your birth, but they're not going to do the hand-holdy, touchy-feely stuff that a midwife would. There are also a lot of family practice physicians that provide prenatal care, and their training is going to vary significantly from provider to provider. Most of the family practice physicians that I work with have also completed an additional obstetrics residency, so they're able to perform C-sections, but there are a lot of family practice providers that don't perform surgery at all, and so they do need a backup provider on call with them to perform C-sections just like a midwife does. If you want to know what type of training your family practice provider has, you can just ask them. When choosing a prenatal care provider, I first encourage patients to think about what environment are they going to feel safe in. Are you going to feel safer in a hospital knowing that an operating room is readily available if needed? Or are you going to feel safer at home knowing that you're less likely to have the natural physiologic process interrupted by modern technology? I gave birth to my daughter at home with a licensed midwife, and I had an absolutely wonderful experience. I knew that if I went to the hospital, I would want to decline pretty much anything they tried to throw at me, like continuous fetal heart monitoring, an IV, Pitocin, so that option just didn't make sense to me. I did end up transferring to the hospital after birth because my placenta was really, really stuck. And so because of that, and because we did IVF this time, and I'm currently on blood thinners, I'm starting my care with an OBGYN this time around. Once I'm off of the blood thinners, if my 20-week ultrasound shows a normal placenta, I'll probably transfer back to my licensed midwife. It's a really personal decision, and what's right for one mama might not be right for another mama. And that's okay. I really hate how divided our culture has become around birth. It feels like a lot of home birth moms will look down on moms that chose to get epidurals, and vice versa. Hospital birth moms will look down on home birth moms and make comments about how they're risking their babies' lives. And it's just not true, and I'm not here for it. Both options are reasonable and safe under different circumstances. All right. Enough preaching. The biggest mistake that I see moms make at their first prenatal appointment is not knowing where their provider attends births. If you are dead set at giving birth at the big medical center the next town over, you should double check that the provider you're going to actually delivers there before you schedule your first prenatal appointment. And you can usually find this information on their website. Sometimes I'll see women for their first prenatal appointment and they'll say, "Oh, I'm so glad you're a midwife. I'm thinking about giving birth at home this time." And I'll have to burst their bubble and say, "I actually don't attend home births. I'm part of a group practice with 2 OBGYNs, and we only attend births at the local hospital." And obviously, I'm happy to give them this information, but it's really frustrating for the patient when they are establishing care somewhere and then they have to start over again at their next visit. The other mistake I see moms make is not knowing what services a provider or a practice offers. Because I work at a small rural hospital with limited blood bank reserves and OR staff that is on call from home overnight, we don't offer vaginal birth after cesarean at our hospital. And it's not that we don't support vaginal birth after cesarean, it's just that it wouldn't be safe to do it at our hospital. But then some patients will come to me at their first visit feeling very strongly about having a vaginal birth when they had a C-section last time. And of course, I'm happy to support them in this decision. I just can't support them at my hospital. So that's another scenario where I'm having to say, unfortunately, we don't provide that service. You're going to have to transfer to another practice. And again, it's just really frustrating for the patient when they've been waiting so long for their first appointment and then immediately get told they need to transfer care. For both delivery location and VBAC services, you should be able to find this information on your provider's website. But if you can't, you can always double check when you call to make the appointment. Other things you might want to ask about would be like water birth, nitrous oxide, things like that if you know you definitely want it when you give birth. And it's okay if you don't know exactly what you want yet. It's your provider's job to provide you with education and help you figure that stuff out. I hope you found this video helpful. I hope it wasn't too long-winded. I feel like I could talk about this subject for hours on end. So certainly if you have questions that I didn't answer about midwifery care or what you can expect from different prenatal providers, please drop a comment below. I'm happy to answer your questions. I post new videos every week about infertility, pregnancy, and my own IVF journey. So please like, subscribe, turn on the notification bell so you don't miss an upload. Thank you so much for watching.